Hi guys, this is Justine Calderwood, physical therapist at the Healing Spot Physical Therapy. I'm at my home because we are officially, or going to be into a stay at home here in Colorado. And so I have my table here. I want to show you guys a release today, a myofascial self-care release to release the upper chest and also the lungs. So I'm going to show you a self-care technique using myself in my own hands. I want to just empower you guys to know that your hands are very, very powerful. And especially if you come from a place of an intention of just allowing whatever kind of love, energy, whatever you want to call it, to kind of flow through your hands and feel what's happening underneath your own hands are super powerful, okay? So even if you're not a trained therapist, you can do a lot of good, okay, to release the fascial tissue, the soft connective tissue of the body. When it gets tightened down, which can happen because we're under a lot of stress right now, okay? It can happen because of illness, okay? And with this virus, you know, it can start in the upper, it can start in the nasal passages and move down to the throat and then cause a lot of restriction into the upper chest. So I want to show you how to release that. And then my daughter is sitting over here out of the way here. She's gonna come over and have she's gonna lie down on the table, and I'm gonna show you how you could do this for a loved one to release the lungs, okay? So I'm gonna lie down and I'm gonna walk you through this, okay? So you're gonna lie down on your back. Hopefully you can see me okay. So what you're gonna do is just take your hands and you can place it just at your your chest, kind of over the heart, below the collarbones. So you're just gonna take one hand here and stack the other hand on top. And all you're gonna do is rest your hands on top and just start to slowly sink down. You're not pushing, you're not trying to do CPR or anything crazy like that. You're just allowing your hands to gently sink down into that fascial tissue. So the fascia covers every single structure of your body. So it's not just a covering underneath the skin. So what you're gonna do is just sink down and start to feel underneath your hands and start to feel the softening, kind of like you're trying to leave an imprint of your hands in soft clay. So it takes 90 seconds to 2 minutes for the fascial tissue to start to release and melt and soften. So you're gonna have to be patient. And it helps if you do this without distractions. Turn the TV off, get off your phone, go into an area of your house where you can be quiet and alone, if that's possible at this point. And just start to notice. So what I'm noticing with my own body, my hands are starting to turn this way. And I'm just allowing my body to show my hands what it needs. So your hands may sink down deeper into the fascial tissue. Your body may start to show your hands in a certain direction where it needs to go. I'm not sliding on the surface of my skin. I don't know if you can see how it's twisting. So what's underneath my hands here is also my heart. A lot of emotions going on right now. So you may feel your heart release, and that's good. Your heart pumps the blood to your whole body. It's also covered with fascial tissue. So if you're feeling the effects of anxiety and you're feeling that tightness in your chest and your heart, this is a really great self-release. So just follow this barrier upon barrier. Let your body unravel. Notice where else you're feeling this in your body. So I'm feeling this up into my neck, my lower jaw, my face, and even down in here. So I haven't moved this hand. That one remains in contact. You want to hold this for at least 3 to 5 minutes. You can go longer if you want, if you have the time and patience. You can never over-release the fascia as long as you're not forcing it. Okay, so that's a self-release for the chest, okay? So I'm gonna have my daughter come now and she's gonna lie down and I'm gonna show you how you can do this for somebody, okay? So Taryn, come on over here. So she's gonna lie down. Hopefully you guys can see this okay. And what I'm gonna do is I'm just gonna bring up her shirt just a little bit. You wanna be on skin to skin contact. You don't wanna do this over top of clothing because then you're just releasing clothing. So you're just going to do skin to skin contact. So one way you can do is just kind of come right at the flare where the ribs can't come out, that little fleshy part. You can have one hand there, and you can have one hand here at the upper chest. Now, just because this is my daughter and I don't want you seeing up her shirt, I'm going to show you the hand placement, but ideally I would be on her skin, okay? And all I'm going to do here is sink down, and I'm just engaging that fascial tissue. I'm feeling that collagenous barrier. She's laughing because she's a teenager. She probably thinks I'm weird. And as somebody that does this, I would never force. You're just like light pressure is better. And you're just waiting for the body to soften and release, okay? I don't know who's watching. Hi, Leslie. How are you? Thanks for tuning in. So that's one way that you can release the chest, okay? And you're going to get that lower lungs, the lower rib cage as well, to help somebody free up the rib cage to breathe a little easier. Another way you can do this, take your hands and just set them side by side. And I would go along this lower rib, okay? So just even imagine what's underneath here, the lungs. You can do this anywhere along, you know, depending on your relationship with the person that you're helping, where you want your hands. But I'm just along her lower rib cage. They can't see a whole lot, okay? But I'm just along her lower rib cage, and I'm just giving her a little hug, just enough where I'm feeling the body start to push back against me. I'm never forcing. If you're doing this for somebody and it feels like you are working too hard, that your arms are getting tired, you are truly working too hard, and you just need to back off the pressure and just wait. All right, if you guys have questions, leave them below. I'm happy to answer this. Reach out if you need any more clarification, okay? So I would hold that again for 3 to 5 minutes, really wait for those releases to occur. It takes 90 seconds to 2 minutes for the fascia to start to release. So if you don't have that much patience to even wait 2 minutes, you're not really doing a whole lot, so don't even waste your time, I feel like. So 3 to 5 minutes or longer. This just might help somebody breathe a little easier. This also boosts the immune system, so you can help somebody fight off some illness even better, and just help their fascia, their connective tissue, be open and mobile. So continue to tune in. I'm going to share these live videos at least weekly. I'm going to try to do them in the evenings because I think I might be able to catch more people, but feel free to share the videos and help me reach more people during this time. So you guys stay well and healthy. Thanks. Bye-bye.